beauty could be, in my eyes and my perception, harmony. I mean, it doesn't mean it's perfect, but there is harmony, you know? We may not have the most beautiful, the perfect teeth, but when you smile with your eyes, with your lips, with your, the expression you have in your face, there's a lot of harmony that makes it beautiful, you know?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Rudy Vega, a orthodontist from the Dental College of Georgia and associate fellow of the American Academy of Implant Dentistry. He loves to spend time with his wife, Carolyn, and his 5-month-old daughter. He's also director of ITI Aesthetic Club in Sugarland. So, Dr. Vega, welcome and glad to have you here.
Hello, Daniel. Thank you very much for the kind introduction. I'll be happy to share this time with you and all the friends and audience.
Yeah, so let's start from the very beginning, Dr. Vega. What got you first interested in the medical field? Let's kind of start there.
As a child, you start thinking your parents, your family members, hey, what are you gonna be, or what would you like to be when you grow up? And then those thoughts start coming to your mind, and it's when I start to rationalize, like, okay, what do I like? What will I enjoy as a job, or as a career, as a profession, or making a living, right?
Mm-hmm.
And I said, well, I like to help people. And then, meeting the doctors, dentists. One time we went to a dentist house, which ended to be my mom's cousin. And then I said, I like what this guy does, He
Mm.
works next to his house and he helps people. He tells the story. He was just helping a patient removing a tooth. At that time, I didn't have an idea what it was about. I was probably 8 or 9, 10 years old. And then it was when I said, well, that could be something interesting.
Mm-hmm.
And growing up, I didn't want to do anything else in like playing soccer with my friends. That was my main thing every day.
Mm-hmm.
And things start getting serious now when you get to middle school, high school, and start to make decisions. That's how those thoughts came for me to become like, or to pursue a career in dentistry.
Got it. Okay. And so now you have your practice, Prosto Dental. What led you to decide to start your own practice?
Okay. After graduation from residency, so I decided to like what I wanted to be. I like independence. I like to help people, and having control or being the decision maker here. I could make exceptions to help patients, family members, and give my signature of work or quality standards, and that's what made me do it.
Okay. So now that you have this practice, I want to talk a little bit more about what you do in the practice. Now, you're a surgical prostodontist. What is a surgical prostodontist?
Prosthodontist is like we rebuild, we replace missing teeth or portions of teeth that had been lost. Like people who grind their teeth, they're clenched, they break or they worn down the teeth, and then we rebuild those teeth, right, to what would be ideal. Or when people miss one, two teeth, then we start making a plan how we're gonna make this work in function and aesthetics and comfort for the patient.
Mm.
And now, technology, equipments, everything is progressing, it's advancing. There's a lot of evolution in all the fields, and implant dentistry is one of them.
Mm.
Implant dentistry, it's a prosthetics that involves a surgical component, which is placing an implant in the bone of the jaws. And for me, being able to also perform the surgery gives me the convenience, gives me the control, also the accountability. I am 100% accountable of what I do, and I'll place it where I think is going to be best for the future tooth or the future prosthesis that's going to be anchored to these implants.
Okay, so what's the difference? Because I haven't heard of a prosthodontist before, but I have heard of orthodontist before. So what's the difference between the two, prosthodontist and orthodontist?
In my opinion, well, all the respect for my colleagues orthodontists, I'm not an expert on that, but I'm gonna give an opinion about their career. They move teeth. They
Mm.
crowded teeth or missing teeth, they close space, also in ideal position with bite, with function, with aesthetics. And we mostly replace. And in
Mm.
situations, we work with different specialties in orthodontics is one of them.
Okay. And so you're talking about implants. So I believe you do everything from a single implant all the way to the all-on X. What is the all-on X procedure?
We start with a single implant. We lose a tooth and we replace it with one implant. Then with an abutment is connected to a crown. So it's three pieces at the end to replace one tooth. It's
Mm.
the implant, the abutment, and the crown. The abutment makes a connection between the implant and the crown. And then when things get more advanced, like you're missing all your teeth or you're about to lose all your teeth, it's like a technique called all-on-4 started to replace, I would say, the whole row of teeth in one jaw with four implants. That's why they call it all-on-4. But
Mm.
it's even if all-on-4 gives you a good distribution to get 12, at least 12 teeth. And sometimes, some patients need more, some patients have more power in the muscles, more bigger jaws. So all on X was like I would say, which gives room to patients who needs 5 or 6 implants or even 8 implants according to their needs.
Okay. And what would be a situation where someone would come in and they would need the all on X? Has it just been years of neglect of not taking care of their teeth? Is it something that is maybe they got in an accident, like a car accident, and they lost their teeth? Or was it just genetic? Like, what are the different situations that someone would need like an all on 4, all on X?
Different scenarios could be for this to be a need for an all on X or for you be recommended an all on 4 or on X by your specialist, right? It could be a prosthodontist or surgeon, general dentist or periodontist, mostly the professionals that recommend these treatments. And it could be you're already wearing dentures for
Mhm.
some time, so many years, I would say most of the times,
Mhm.
and you're uncomfortable with it. And as I said, 20, 30 years ago, the all-on-4 was not like a standard of care as we consider it today. So at that time, most of the patients were having like dentures or removable prosthesis. And it's when now the all-on-4 has become like very standard and easy to learn, not easy to learn, but there is like institutions that teach you, training centers, a lot of professors, a lot of research on that. Then the patients are looking more into this, and we feel comfortable to provide this treatment for them and make it like more comfortable. So wearing dentures will be one of the scenarios where you will be recommended to have an all-on-4. The other one is like we call gum disease or periodontal disease, when you lose your bone and the teeth start becoming like movable. Then after severe mobility and the different specialists in dental fields see that these teeth won't be good for long term, is what can we do before we lose the teeth and you are without teeth? Can we catch up that and give you something like just right before you lose them? So this is what we call like terminal dentition and immediate loading. So meaning like we know that these teeth are hopeless. So we're gonna remove it, and then the same day, in many scenarios, I would say not 100%, not all of the scenarios, but in many or most of them, you're able to place at least 4 implants and anchor the teeth the same day to the implants. And
Mm,
they call nowadays like teeth in a day or same day teeth. Most of the time, these teeth are temporary, and that would be my recommendation too. That this first set of teeth that you got the same day, which is called immediate loading. It means like you place the implant and immediately you load the teeth over the implants.
mm,
And you let it heal, which would be 4 to 6 months in average standard time. And then you start fabricating your permanent teeth. So that
got
would
it.
be second scenario, no?
Mm,
First, dentures, second, terminal dentition, and
okay.
then any other scenarios like where you mentioned car accidents or a lot of cavities and your teeth is hopeless also eventually.
Okay. Now, you also provide full mouth rehabilitation. Is that kind of like a broad term that would include implants, all on fours, all on X, or is it something that's different?
It's similar. I would I would say all on four is a full mouth reconstruction or
Mm,
rehabilitation with implants and and prosthesis that it could be made out of the different materials nowadays, zirconia, PMMA, or tie bar with PMMA teeth, which we call a hybrid because it has the tie bar that connects with the titanium bar that connects with four implants, and then is wrapped with PMMA teeth. And the full mouth rehabilitation reconstruction could be in the dental field. We mostly use it when you have worn down teeth, you have probably one or two missing teeth, and then you rebuild with crowns, with veneers, with single implants, or it could be all crowns. For example, a person that has a lot of cavities, extended cavities, root canals, and worn down teeth. And there is another I would say condition that destroys the teeth or wears them, which is erosion, meaning like acid reflux that destroys the enamel of the teeth, and that's another way to rebuild it. Full mouth reconstruction could be a combination of many things. Could be a couple fillings, a few crowns, a few veneers, and one or two single implants. That would be any scenario for that.
mm. Okay. Now, when it comes to cosmetic dentistry, how would you, I guess, define which procedures would fall under cosmetic dentistry and which ones would fall under more, I guess, functional dentistry, where it's like, hey, if I'm missing my teeth and like I don't have dentures, like I need to chew. So that's functional. But some of the other things would be a little bit more cosmetic, like, oh, I'm missing one tooth, so I want to replace it. So what's that line between the cosmetic and the functional side of dentistry?
I would say at some point overlap. I would say most of the patients or many patients will look for to have a good appearance, especially now the age of social media, now with all these virtual podcasts that we're having today with you and websites that where you work, you are the image. I would say many patients look for to have a good appearance, right? And it's when a professional can tell you, okay, we can work in your appearance will be cosmetic, like teeth whitening, no? You chip up a tooth when you were a child, then you can replace it probably with a small veneer, close some gaps like you may like, you may not like, and then there's opportunity to close. And this when cosmetic dentistry, is an option. I would say as once you start to kind of improve the bite or rebuild, like what we call the vertical dimension, which meaning you have to raise the whole bite because it has collapsed. Once you have worn down the teeth, so your jaws start closing because you have lost some vertical dimension, which means the ideal height of your teeth, which helps you to hold your jaw, your muscles, helps to hold the jaw related to the skull. And as people lose the teeth, so this collapse, and that's why we have that appearance like we don't have teeth, right? And that's when you start to rebuild that, I would consider it more functional.
Got it. Okay. Now, across all the different treatments that you provide, Dr. Vega, what would you say is some of the most common misconceptions or myths that you hear from your patients?
Um, Tell me an example of an idea
Yeah,
of.
so like if someone comes in and they think that all dentistry procedures are painful, like that could be like a myth that they believe.
Let me.
Um,
I would say now it comes to my mind.
mhm,
Eh, I would say it's still a surgery, and a surgery is a surgery. You could
mhm,
be sedated now, but it's still surgery. I would say misconception is when patients have lost a tooth, they have lost and they pull that tooth. And usually when you pull a tooth, this is a fracture, it's an infection, so it's already like trauma. You already come to the dentist or to the dental office or your specialist with some pain, with some infections, and it's when you think like, you know, the implant could be a similar experience.
mm,
But for
mm,
example, you already lost the tooth and the side has healed. In that scenario, then you don't have more infections, you don't have more trauma, and it's like I would say a beneficial trauma that we would do by placing the implant. But
mm,
since the area is already healed, the infection is gone, I'm not gonna say like it's painless, but compared to the extraction and the implant placement, I would say discomfort, soreness after surgery, it's way less than the extraction.
okay, good to
It's
know.
patients like, oh, that's it? You finished? Okay, we
Yeah.
placed the implant. They didn't feel that much trauma when you have to remove like broken pieces there, infected, and usually they have a harder time to be numb. When
Mm, okay.
another misconception could be like for example, there's some marketing, which nothing wrong with that. It's part of it. When you say teeth in a day, it means like,
Mm,
okay, I came in a day and that's it. I finished, I won't see you anymore. So, but we need to let this see most of the times, and that will be my recommendation, um, to let it heal and have follow-ups. And after 3, 4, 6 months, whatever your implant specialist or implant dentist recommend you, could then you will get your final restoration.
okay. Now, Dr. Vega, let's say that somebody is looking for one of these types of procedures, implants, all on X, all on 4, whatever it is. But let's say that they're looking for a dentist. They don't know anybody off the top of their head. What advice would you give to this person so that they can find the right dentist who has the knowledge, has the experience, and can ultimately get them the end result they're looking for?
But first information, we are in the age of information. We have Google. I will see the credentials of the dentist or the specialist. It could be a general dentist that's well prepared, like he has taken a lot of fellowships or continuing educations. He's member of American Academy of Implant Dentistry, for example, or any other organizations that support him as dental, as an implant specialist or surgeon or restorative. Also, confirm with your provider if he's only restorative or surgical. So what happened also with the surgeons and periodontists, they mostly focus in the surgical component. Then you'll need to find a restorative doctor, a prosthodontist that also will take care of your restoration of the tooth that is going to go on top of that implant, the prosthesis. So
Mhm,
that's what I would do.
mhm,
Nowadays, probably I don't know if it's gonna sound like some marketing here, but that's what most of my patients do. They go see your Google reviews, they go see your social media, they then the word of mouth. Those would be the reason what I would look into for
mhm.
the or to choose a, a dentist or any medical doctor or implant specialist.
Okay. And how important is, I guess, what role does creativity play in how you approach patient care? Because I think when people think about medicine, they think about dentistry. Creativity is maybe not the word that they would use, but I mean, do you think that creativity has a role in what you do?
I would say yes, because it's a component like, you can not always have the ideal world, the ideal condition. It could be in different means, anatomical deficiencies, anatomical limitations, and budget limitations, and expectations of the patient.
Mhm.
Yes, you got to be creative, I would say, at some point.
Mm.
And being, I would say, providing the a good function, comfort for the patient, pleasing smile, pleasing phonetics. Did that answer your question?
Yeah, I would say so. Now, when it comes to the future, Dr. Vega, where do you think the future of dentistry is going?
I would like to go back a little bit to
Yeah.
the question. We have two questions behind.
Okay.
One is a misconception, I would say. When we get implants, implants need maintenance.
Mm.
It doesn't mean that we're gonna, once your implant has healed, you don't need more, you cannot be infected, or teeth don't get plaque or build up, or dental implants don't get plaque or build up around it. So we need to maintain those. We need to brush and floss and water pick, which it helps a lot to maintain those implants clean, and the prosthesis also.
Mm.
And go at least, I would say, at the latest once a year to review, to do a checkup, a follow-up in your implant.
Mm.
Okay.
Okay.
I wanted to add that.
Yeah,
But
all good.
I thought it was really important.
Yeah. Now, for the future, going back to the future question, where do you think the future of dentistry is going?
Yeah. Well, when I started dentistry with the analog,
Mm.
meaning with my hands, and now we have the digital dentistry, scanners or 3D imaging. And the beginning is, well, I don't know how this is gonna work, but after going through this phase, I would say it could go anywhere. I don't know what we're gonna do next. Probably robots helping us a lot. Uh, I like the human touch, but I don't control the world, so I would need to adapt at some point.
Yeah.
And I think like everything, or anything in life, if we use it in the right way, technology is going to help us a lot. It's going to be a good benefit.
AI and robotics is fast catching up on things.
So you already have a couple of robots like helping you to place implants,
Yeah. Yeah.
you plan everything digitally, and you kind of grab, or pretty much the robot grabs you
Mhm.
and takes your hand to wherever you're
Mm.
gonna.
Interesting. Okay. And with the future in mind, what is the vision you have for your practice, Dr. Vega?
Yeah, well, the first thing are the patients. No, we're here for the patients. I know we make a living with our patient. It's our passion to do this. It's for me, at least for me.
Mhm.
But at the end, is what is best for them, the patients, and we need to adapt, evolve to continue providing the best for them.
Mm. Okay. Now, Dr. Vega, I do have one last question for you, but before I ask it, I do want to point people to your website at prosthodental.com.
That's
Now,
correct. Then.
yep. Now, last question for you, Dr. Vega. What does beauty mean to you?
Beauty is, we were just having in the study club that, I'm director here, ITI study club in Sugarland. If any other colleagues are in the area would like to join us, we started this year, and we're looking forward to continue many, many years. And we had a lecture here, and what's beauty. We were talking about Michelangelo. Michelangelo is called the Beat of David,
Mm.
which is Florence, Italy. And for many artists or beauty experts, they said, "Oh, this is the most perfect sculpture about human body, human uh, shapes and forms of standards of anatomy for the men." But then there's another guy in, I think, recent couple of years passed away in Colombia. It's called Botero, and it's, well, now we can Google it. It's an artist, or was an artist, that made a lot of paints and sculptures also, but in out of proportions, like magnifying the proportions that we have as standards of ideal or perfect. And we could see, like, in these shapes, in these expressions that he was doing, there was also beauty, no? And beauty could be, in my eyes and my perception, harmony. I mean, it doesn't mean it's perfect, but there is harmony, you know? We may not have the most beautiful, the perfect teeth, but when you smile with your eyes, with your lips, with your, you know, the expression you have in your face, there's a lot of harmony that makes it beautiful, you know.
Well, very well said, Dr. Vega. Well, there you have it. Dr. Vega sharing his expertise. So, Doctor, where can people contact you in your practice?
Yeah, we are, you know, through the website now, www.prestodental.com, and the phone number is 281-207-0782, and the social media is also from the office.
Okay, awesome. Well, Dr. Vega, this is great. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your expertise.
You're very welcome, Danny. Thank you for.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.